So let's talk about the most notable changes. We had touched on this before, the metallic levels. Bronze, silver, gold, platinum. They were designed for a couple reasons to allow consumers to do comparative analysis. So if you're looking at a bronze plan from one carrier to the other, you're looking at a plan that essentially has the same actuarial value of benefits, meaning that the amount that the plan or the insurance carrier is going to pick up is the same in any bronze plan to any bronze plan. The higher the plan, the more the actual contract will pick up in cost. So a gold plan, you're going to have lower deductibles, lower cost shares, etc. So if you're looking at a gold plan compared to a bronze plan, you have more potential out-of-pocket in a bronze plan than you do with a gold. So you can think of it about as your potential out-of-pocket. The lower the plan, the more potential out-of-pocket for you, the lower the premium, and vice versa as you get to the opposite end of the extreme.
How are those things differentiated? Like, I'm just curious for my own, I have healthcare, I offer my employees healthcare coverage, always have.
Mm-hmm.
What am I giving them a gold, a silver, a bronze, a platinum? What?
Well, the starting point typically has been everybody is being mapped upon renewal. So any of you that are renewing January 1, you've already seen this. Everybody's being mapped to the closest plan to what you're offering now. So if you have two plans, you're going to be mapped to two plans, and the mapping will tell you whether that's a silver plan, a bronze plan, a gold plan, etc. So that's typically your starting point. Where was I last year? And now what does that look like this year? Okay, so that you'll know whether you're in a bronze, gold, or silver. I haven't honestly seen too many plans in platinum.
Would my insurance agent know that? If you know, here's the plan we're actually renewing, like.
When do you renew?
January. Yeah, we're
Yes.
in the process. So could I?
Well, actually, you're a large group. The metallic levels do not apply to large group.
Sorry.
So you won't necessarily see that. The large group rules are a little different.
So that mean every silver plan has like an 80, no matter whether it's Aetna, Horizon, whoever it is, has an 80-20 coverage?
No.
And every bronze plan maybe has 50-50?
No, you can't look at the co-insurance, the deductible, and co-pays per se and say that they all are going to be designed there. The differential is an actuarial calculation as to what percentage is the plan going to pick up versus what percentage are you as an individual going to pick up. It can't be defined by looking just at the plan, but essentially it takes an average individual and the expected out-of-pocket costs for such individual under this plan. How much would the plan pick up? How much would the individual pick up? So when you're looking at a silver plan, 70% of the costs are typically picked up by the plan, 30% by the consumer. The way they design it, whether it's through co-insurance or deductibles or co-pays, can vary between the plans. Essential health benefits, and I'm sorry, Ron, this all does apply, these terms apply to small group.
Okay, that's fine.
Essential health benefits are 10 categories of benefits that every insurance contract must have. Again, to equalize and assure that there's a minimum value of quality amongst all plans. The essential benefits are ones that we're all familiar with: ambulatory care, hospitalization, prescription, pediatric care, preventive, rehab, maternity, mental health, and the last one that they snuck in there was this pediatric dental and vision. Now, each of the carriers is handling the pediatric dental and vision differently, just to make it a little bit more confusing. Some contracts actually have the dental built into the plan. So when you look at your plan design online or with your broker, you have to ask the question, is the dental included? So Horizon is not including it. For every member of your group that's under the age of 19, you must purchase a separate dental contract. You can purchase it from Horizon, or you can purchase it from anybody else, but you do have to attest that you do have a pediatric dental plan.
What ages are considered pediatric?
Under the age of 19 for this purpose. AmeriHealth, they have a contract price, but if you have anybody in your group that meets the pediatric dental requirement, you have to buy a rider, and it charges additional premium to everybody in the group. Aetna, I believe, is embedded. Oxford, I believe, is embedded. So you have to ask that question, where is the pediatric dental, and do you need to do anything when you're taking a look at the cost of your plan? Adjusted community rating, this is the big one, and this is the big one that's really creating chaos right now, is essentially everybody's being thrown into one rate pool, and they're being rated based on their age and their geography. So it eliminated a lot of the risk factors that used to exist, and I'm going to get into that a little bit more in the next slide, because it's not only that everybody gets an age rate, they are now, every member is getting a buildup of rate based on the number of participants in their family.
Just back to the age base on pediatric dental and vision. If it's embedded, it's obviously calculated to your rate if you're in a small group, right?
Right.
If it's not embedded and it's an extra, is it only it's charged to everybody, whether
No,
there's
well,
children in the plan? If you have no children coverage, you're still paying for a pediatric dental?
In AmeriHealth you are. In Horizon you're not. So in Horizon you buy it for those that meet the pediatric definition. For AmeriHealth, I do not understand why. This really threw me, is that you have to buy a rider, and they apply the rider across the board to every member of the group. But I mean, it's basically at the end, you go to somebody, basically you look at the cost in the end, and you look at the full loaded cost for AmeriHealth versus your full loaded cost from Horizon, and look at the plan benefits and make your decision. It's just a little deceiving. It's not completely transparent, if you ask me. In New Jersey, there's no, the law did allow for tobacco rating, but in New Jersey, they are not using tobacco usage. The taxes and fees, and we're seeing a lot of premium increase. Some of that is attributable to the fact that these taxes and fees are now being added to your premiums. They're being passed through from the carriers. 90-day waiting period is the maximum waiting period that any contract can have. Now, very often contracts had 90 days, the first day of the month following 90 days of employment. Those are no longer valid. I believe all the carriers are modifying their contracts to eliminate that, but you should just check on that. I had some groups that had 180-day waiting periods. They have to change theirs, obviously, to 90 days. So it's your first renewal after January 1st, 2014, where that will apply. There was recently a regulation modification to the use it or lose it rule with flexible spending accounts, and I think this one's worth noting. A lot of people hesitated to offer flex spending accounts or use flex spending costs because of this use it or lose it rule. They are trying to make the use of flex spending accounts, get more people participating. So they've added this modification where there is a $500 carryover for any member of a group that's elected a flex spending account and doesn't use it. So let's go by example. If you elected the $2,500 and in 2013, your expenses only reached $2,000. Normally, you would lose your $500. They are now allowing, and it's not valid until 2014, but they're allowing you to roll over that $500 and not lose it.